panelists. So tonight our panel is Behind the Scenes of COVID-19. It's a look at the health district response from sort of the beginning of the pandemic. And our presenters tonight, if you would like to introduce yourselves, Tracy, you can start.
Sure. Good evening, everyone. My name is Tracy Avery Jeter. I am the lead nurse practitioner for the Richmond and Henrico Health District. Yep. Did you want?
That's fine. Dave?
I'm Dave Stansbury, and I am one of the
I'm Teresa Stansbury. Good evening, everyone. I'm a registered nurse, and I started volunteering as an MRC RN in March of 2020.
Dr. Veray?
Hey everyone, my name is Melissa Veray. I am the Deputy Director for the Richmond and Henrico Health District.
And Takendra?
Good evening, everyone. My name is Takendra Westbrook, and I'm the District Epidemiologist for the Henrico County Health Department.
Great. Thank you all so much for participating in this with us. And Adrenia has a video that she would like to share with everyone. And I'm sure you'll all remember this, especially any of the coordinators that are on here right now.
New at noon here in Virginia, Governor Northam says the state needs about 30,000 medical and non-medical volunteers to join in the fight against the coronavirus. Governor Northam says those volunteers would help provide support during the expected surge of patients in hospitals and long-term care facilities across Virginia. State leaders are working with colleges and universities to recruit students, especially those in medical programs, to step up. The State Health Department's Medical Reserve Corps is also reaching out to anyone who has recently filed for unemployment or has relevant experience. You can find more information on vamrc.org.
I definitely remember that feeling of panic when that came out. All right, Alyssa, do you want to take it away with the first round of questions?
Absolutely. So this first question is for Dr. Veray, Takendra, and Tracy. So Dr. Veray, we'll start with you, but what was your role prior to COVID? How did it change at the outset of the pandemic? And did it evolve over the duration of the pandemic?
Gosh. Before the pandemic, I was still Deputy Director for Richmond and Henrico Health Districts. I think what happened really with COVID was at its outset, it was really just the EPIs. During February, mid-February, we were hearing things in January and February. In February, when we were first starting to follow, that there's a little bit of testing. There are patients under investigation. Everything had to be approved by CDC. Our EPI team, our EPIs were getting lots of phone calls and having to approve tests every time I had to go. They were getting calls at all hours of night. And luckily, as things moved on, we were able to stand up more of a team and double our size. So over the course of the pandemic, gosh, it varied from subject matter expert to medical director to sometime acting director to whatever needed to be done. And I think that's probably true of a lot of folks on the call tonight, in that it was, there weren't a lot of things that you didn't do at some point along the way, just based on what we all had to put together to make things happen, especially in those first couple of months.
Takendra, same question.
All right. So at the start of the pandemic, I was in Charlottesville. In the Blue Ridge Health District. I was the local DIS, disease intervention specialist. So I focused on HIV and syphilis cases, but I was embedded within the EPI team. So the district epidemiologist was my supervisor. So Once cases started rolling in next to nurses, I had the most case investigating and contact tracing experience. So I jumped in there. Shortly afterwards, I would say roughly around March, I became the acting district epi. And so everything just came fast and furious. I became the point of contact for the health district. So that meant, again, late night phone calls from the hospital to report cases. I was the point of contact to UVA. They were doing a lot of testing there. So I had to approve all testing that went to UVA. Yeah, it was a lot of hats throughout the pandemic. Throughout the pandemic, it changed a lot.
And Tracy, same question.
Yes. So at the beginning, my role prior to COVID, so I was the nurse practitioner supervisor and lab program supervisor and pharmacy. So just different areas. My normal job was just working in the clinic, helping to organize our nurse practitioner team and our lab teams. So then when COVID hit and that faithful call came in, my job was trying to figure out what would our NP staff and our lab staff do at that point to support. And the first thing that the NP staff did was provide support for our community providers. So if the providers called into the call center, if they had questions, we provided support and outreach for the community providers. And then as time kind of went on, and when I say time, I mean like a couple of days, because things changed very quickly. Then we started testing in the nursing homes. And so I acted as the testing trainer for our nasopharyngeal testing that we were doing in the nursing homes. That then kind of switched on a little bit, and we decided that we needed to do community testing. And then I started to lead the community testing outreach. And that was a pretty large event. And then as the testing started to wane down a little bit, I did monitoring some of the vaccine pods and those events. And that was about it. So just kind of going through that way.
Great. Teresa and Dave, we have two separate questions for you guys. So how did you become involved in the MRC? And what about the pandemic caused you to want to volunteer?
So I practiced nursing for 35 years. 25 of those were in hospitals, mainly in ICUs. Now retired in late 2018 and then started volunteering in a free clinic. So in February of 2020, I received a letter from Dr. Oliver requesting up to be a volunteer with. So I pounced right on it. Weeks I heard from Kate. Late March, early April, I had been fit tested for an N95 mask. I had training on testing. It happened very quickly. It was very well organized.
Okay, well, I guess that's over to me. I kind of look at that as almost two questions in one. What caused me to become involved, and then what kept me involved. It's one thing to show up a first time, and then it's another thing to keep coming back. And the first thing was very much my wife. She was the one that got the notifications from her background, and I thought that sounded really interesting and wanted to tag along. And I think both of us just, it was a sort of unprecedented time, and we wanted to feel like we were trying to do something to help out. What caused me to continue to want to come back, I kind of break down into two things. First, the volunteer coordinators, and before we met the other part of the Kate and Alyssa tag team, starting with Kate, it was just a very welcoming, hey, we want a feeling of we want you to be here. How can we enable you to be here and help out? The second part of keeping me wanting to come back started really with the first event that we did after things like fit testing and all those sorts of things. And it was one of the first, I believe, community testing events in an apartment complex. I think it was the Woodman West, if I remember correctly. And it was very much, I come from a military background where you're standing up things new a lot of times, and a from whole cloth, everybody trying to figure it out as they go. There were no tents. I'll always remember it started to drizzle, and we didn't want the forms to get climbing under the table to fill out the forms so we could get everybody registered and everybody an opportunity to get tested. And what really impressed me and kept me coming back was the teamwork, and that everybody got together afterwards and said, okay, what have we learned from this event? And then to see the team adapt everything, and immediately by the next event, everything that we had learned was implemented, was changed. And that was the way it was throughout. And that really kept me wanting to come back, was just the amazing teamwork and watching how quickly the health department team leading the volunteer group changed and made us all feel part of the team and welcome.
Awesome. Thank you, everyone, for those awesome answers. If anyone, any participants, anyone watching has any questions, now is a great time to put those in the chat box. We have a few minutes here to do some Q&As. So I'll just give it a little bit, see if anyone has any questions, and if not, we'll move on to our second round. All right.
All right. So if nobody, oh,
Go ahead, Kate. You're good.
oh no, there's one question. Just came in.
How about database management across the region? Is that in general? Are you speaking volunteer side, or are you speaking more health district side? And was training provided?
I know, Dr. Veray, you want to take that one?
If we're talking not about if we're not talking about the volunteer side, I know that one of the things that it might be laws, it might be all manager site and coordinating with a chapter. But I'm happy to talk about it from the VED standpoint. But I think from the standpoint of we all but doubled our workforce. We doubled our staff pretty much. We went from 200 to 400 in a really short amount of time. And a fair number of them were brought on specifically for contact tracing and case investigation. So there was an enormous amount of work that we put into developing a training program and then onboarding all of these folks, getting the computers, getting them logins, training them to use VEDs, training them in the case investigation process, and then getting them to input data, all of these things, trying to get them all semi-regionalized, but we know because for VEDs, for example, for the case investigation, there needs to be some uniformity in terms of what they require in minimum data requirements. It was helped because from central office there would be some standardized stuff coming down the pipeline, but we know that there is some variation between districts, but we tried to coordinate amongst the region to try to create some degree of uniformity, but we know that there was some variation between districts when it came to how we did things. I don't know if other folks want to chime in on that.
Well, if if the question was about the unit management and how we managed the volunteer database, whew, that's basically the answer. So we got, at the very beginning, it was a little hairy with all the volunteers coming in. And I'm sure each unit coordinator has a few different things to say about it. We were very lucky though that at the state level, excuse me, we had a lot of support. And at the state level, they were able to bring in a decent amount of people to help us with the background investigations, to help us with getting applications sorted as quickly as we possibly could. I mean, some units were having hundreds of people apply a week, thousands at a time, and it was amazing and slightly terrifying at the same time. Alyssa, do you have anything to add to that?
No, I was going to say the state staff really, in our database that we use, as volunteers know, we use the Virginia Volunteer Health System, VVHS, is really a great system because our state staff were able to add a lot of function and features to it that made our jobs easier. So yeah, we have a few more questions. Were you confident in the initial risk of COVID and subsequent PPE or communication of the risk?
That's probably me. Maybe that might be me. I think what was an interesting challenge around COVID, especially from the get-go, and TK can maybe speak, TK and Tech, or Tracy can probably also speak to this too, is just how much we knew we didn't know. We knew some things about coronaviruses in general. We knew some things just based on respiratory virus, but this was a new virus. We were learning things, and the information we were getting, the science was evolving almost on a day-by-day basis. And so it proved an incredible challenge with regards to risk communication, making sure that people were not, because people were afraid, trying to manage people's anxiety around their risk, and also making sure that people were taking adequate precautions and not blowing things off. And then we had to change. First, we didn't want you to mask, then we did want you to mask, then we did want this, then we didn't want that. And so as the science evolved, it was just a lot of trying to stay abreast of the science, speak to what we didn't know, or being honest about being honest about the uncertainty that we had, because it's difficult to say, look, we don't know a lot right now. We're hoping, and we know a whole lot more now than we did back then. But in March 2020, there was a lot we didn't know. And so there was a lot we had to do with regards to trying to make sure people were adequately protected that maybe was beyond what we might do, what we know now. But at the same time, it was a very different time back then. We had a very naive, immunogenically naive population. And so I would say that, I don't know that anybody was 100% confident in anything at that point, but I do think some of the things that we took had protected us against a lot of other things. And so we had a fair amount of belief in our PPE as used appropriately, which had protected us against a number of things. But what we just knew that we didn't know everything there was to know, so to say. We knew how to use PPE, and we knew what PPE could protect us against otherwise. So it was a reasonable belief that we would be in fairly good hands. It did lead to us sometimes being perhaps very, very PPE'd up. So I'll talk to Tracy, for example. I know that you can speak to, for example, because you were out there in the front lines doing testing up front, and then vaccination later. We would gear up. They honestly, because Tracy was on the front lines, and y'all as MRC would gear up on the front lines. We put you all in all of the gear. And I know that there's nothing comfortable about being in all of the gear. And, now we don't have to do quite as much because we know more. We didn't back then. And so I would say we erred on the side of caution, and that was probably a good thing. Tracy, what do you say? Any comments you would make?
Yeah, definitely. So with my experience with testing, so the first thing, part of what I was doing when I was teaching our MRC, well, at that time teaching the nurses how to do nasopharyngeal swabs, we talked about PPE and appropriate use of PPE. So what we erred on the side of as far as what we knew were respiratory precautions and droplet precautions, and then providing PPE in those situations. So then when we started to have volunteers, we taught them the same thing. We quickly realized that we needed to have a safety officer, and we had to have someone whose main purpose at their events was to be able to make sure everyone had appropriate PPE and that everyone knew how to don and doff appropriately. So wonderful. We had a gentleman named Don who actually took care of our donning and doffing. And so it was wonderful. And so just being able to focus on making sure that our volunteers were safe, making sure that all of our staff were safe. Initially, we were going into nursing homes, and so where the largest amount of outbreak was occurring, and just making sure that everyone was covered from head to toe, as Melissa was saying. And then the second part of that is just knowing how to take off that PPE. So, I mean, you know how to put it on, but how do you take it off so that you remain safe and that the people that are near you when you're taking it off remain safe? So, just teaching all of that from beginning to end. Initially, when COVID started, we were talking about March. Then we went through the summer, so it was extremely hot. Then we went through the winter, and it was cold. And then we continued in the winter, and it was cold. And then it was hot, and so we did this kind of back and forth. And we tested for a long time. We're still testing, and we're still testing. And we tested. We looked for inside. Well, we weren't talking about that, but just more talking about the PPE, I am very proud to say that none of our MRC caught COVID from testing events. The entire time we tested from March of 2020 all the way until probably the end of 2021, no one reported that they had caught COVID from our events while they were working with us. And we really do believe, because we always said that safety is first. Safety is first. And we definitely wanted to make sure that our MRC and our staff were safe, because they made a decision to come out and to test with us, and we wanted to make sure everyone remained safe.
I would just real quick volunteer side to say that while we both had a basic comfort level with PPE, with Teresa from nursing, with me from the rescue squad, as a volunteer on site, there was always emphasis, materials, support, training that I think we both felt very comfortable always with the site and the staffing and situation from a PPE and a protection perspective, because of how it was presented by the department.
We just have two more questions this round. What are the most important resources that were not available at the beginning of COVID that we developed during this response and will be sustained for MRC volunteers across responses for future events or outbreak situations?
I think that's for us, Alyssa.
I was going to say, I actually think that's for you guys, for you folks.
Well, I think the glaringly obvious answer for this is the amount of volunteers that we had prior to COVID versus that we onboarded. So I know for Greater Richmond, which was Richmond City and Henrico Chickahominy, two separate units, I think combined total before COVID, we had maybe 500, 600 deployable volunteers. And then now we have over 3,000. So I think it was that, which is fantastic, but it's that initial, how are we going to do this? You know, in our area here, you know, everywhere was a big deal. We were very active down here, so that recruitment of those 30,000 volunteers, you know, that was the biggest resource that we really needed, in making sure that we had volunteers to help support our staff and our events. And you guys really showed up, came out and showed up, did not disappoint. Still makes us emotional thinking about how many of you stayed with us. We were volunteers before COVID, stayed with us during COVID, and those who joined during the pandemic. And I think internally with MRC, we've built these teams now, you know, testing teams, vaccination teams, epi response teams, where if we see future outbreaks or, God forbid, another pandemic, don't want to put those words out in the universe, but, you know, we have so many volunteers who are trained now, who have the knowledge and the background from volunteering with us during COVID, that we can sustain these activities in the future. And it's just about us providing constant or recurring training to our volunteers to make sure those skills and that training is updated. And there's always going to be kind of just-in-time on-site training for different things, but we have that large cadre of volunteers who have been with us during COVID, so that way we have those teams already built. Kate, did I miss anything?
Well, I would just say on top of that is also we were able to make a significant amount of sort of changes and additions and what's that word, to make things improvements to VVHS, which will, be very helpful, moving forward. And we were able to do that very quickly because the company that runs VVHS for us is super great. And so we were able to change the way we alert and change the way we do background investigations and all kinds of things very quickly to make sure that we were onboarding folks quickly and appropriately and getting everybody's information and licensing and all of that. And that will definitely be helpful, moving forward.
We have one last question for this round, but I want to say if anyone has questions during the next round, put them in the chat box because we'll have another audience Q&A after our second round of questions. So last question for now, was case reporting directly to VDH, CDC, or creating pooling site data?
That can be me or TK. I think I'll take a first pass. TK can add what she likes or what needs to be added. One of the things that was kind of good that happened right up front is that we made, because of emergency declarations and on the public health emergency, the COVID became reportable. And so with labs and with physicians, but primarily a lot of the information, and the fastest way to get information to us for reporting purposes is through laboratory reporting. Physicians are notoriously ungreat, and I use ungreat specifically. We're not very good at reporting. We're not very good at reporting in a timely fashion. So we really rely, when it comes to surveillance, on things like electronic lab reporting or lab reporting period as a way to capture numbers and information quickly. So setting that up front, where every lab that tested, so every physician that ordered a lab, because the physician had to order at that point, who ordered a lab, would then making sure those labs came back to us at VDH. We would then intake them, do the case investigation, and then contact tracing for that individual positive. And then our information would then get funneled up to CDC. And that's how, when we were doing one-to-one case investigation and contact tracing, how we would get as much information about all of our cases and know what our case numbers were and when their onset dates were. Because every time we got a positive, we would call them and we would try to contact them, and we would, see if we could find out as much information as possible. By the time we were getting to 2021 and we were sitting on hundreds of cases a day, it became a little less feasible to do one-to-one case investigation. And we were also at a different point in time in January of December of 2021, January of 2022, we were in a very different place when it compared to at the outset of the pandemic. And so we changed things along the way, but that's how case investigation and case reporting happened right up front. TK, anything you'd add?
The only thing I would add is that the infection preventionists at the hospitals, they would give us a call right away too. So whether the test was confirmed at the time, if there was a clinical diagnosis, they knew that, healthcare workers came in contact, they called us immediately. And that was the most rapid way to let us know of those cases. So they dialed us up day and night, literally night. I remember getting a few calls past 11 p.m. So yeah, the IPs, they were super important in case reporting as well.
Great. Thank you all so much for those great questions. And we'll hold the ones that are in there until the next open question session. So the second round of panelist questions, we'll start with Dr. Beret. What were some leadership challenges that you faced?
There were lots. I think I alluded to this before. We doubled our size in a really short period of time. And we were asking folks to take on roles they had never taken on before. We were asking them above that to train folks, large pools of folks, in this new area of work they hadn't done before, a lot of them, in terms of contact tracing, case investigation. And then perhaps we had to do this en masse. And then as things evolved, we had to have them to pivot. So perhaps they were starting off in one area, but then we needed a call center. But then we needed vaccine information. But then we needed a long-term care facility expertise so that we could go into long-term care. So we were asking people to develop expertise and then sometimes to pivot and apply that expertise elsewhere, or sometimes to pivot and do something else entirely, because that's what we needed them to do. And so to really drive all of this forward was not one leader, was a number of leaders and a really amazing team that took on this task of being both really trying to be as nimble as possible so that we could pivot as fast as we needed to, but also try to really get at these ideas of containment, of testing when vaccination came out, to really promote and get testing out there as much as possible. And really keeping in mind these concepts of equity, because health equity came out very early on in the pandemic in terms of there were folks who were, because of the inability to stay home when they were sick because they had to work, because inability to, there's no paid sick leave, because they had to work to eat. There were people who, or because they were in multi-generational households, they couldn't isolate appropriately. There were reasons why, very legit reasons why, certain folks were disproportionately impacted, especially at the outset of COVID. And so health equity and addressing these and keeping that in mind was an underpinning concept throughout. And it takes, and it can be harder, that it's more work to do it that way, but it was incredibly important to do that and for this team to lead with that in mind as we were going forward. And I will say that on top of that, I think if we hadn't had, Alyssa and Bosman, and on the Richmond Henrico side, if we hadn't had Alyssa and Bosman to help us with the agility end of that and the nimbleness end of that, to be able to say, hi, we have 10,000 vaccines that we could use. They just said, can we use 10,000 vaccines? We're saying yes. Can you help us use those vaccines? Bosman and Alyssa found us volunteers to get those vaccines at the door so that we can be as fast and as nimble as we could be in a rapidly changing environment. So I don't know if that was a challenge. It was a challenge. I don't know if it was a challenge for me alone. It was a challenge for all of us to try and steer together, keep equity in mind, work through a lot of uncertainty because we didn't know the answers sometimes. And just, it was a lot of change for a lot of people all the time. And that can be really uncomfortable and very unsettling. But at the same time, we saw some of the most amazing work that I think our district has done. I feel like we did in the 3 years of, in the time of the pandemic. So not sure if that answered the question, but that's my answer.
No, that's great. Thank you so much. Oop. Apparently, I don't know how to use my buttons here. So the next question is for Tracy. So when it became evident that we would need to heavily engage the Medical Reserve Corps to respond to COVID, what were your expectations and how were they met or not met or exceeded?
Well, definitely. So I think as Dave was talking about, when we had that first event at Woodman West, we had a few volunteers and we had more, I guess, VDH staff, probably about maybe half and half. And we saw a few people, but then shortly as our events started to pick up, we saw more and more people and we realized that we needed more and more. One of the things that we did, as Dave mentioned, was kind of readjust what we would need, starting to determine what positions were needed and how many people in each position. So how many registration, how many testers, how many greeters, and how many volunteers that we needed to fill all these spots. And then once we were able to do that, it was, we needed more and more and more, actually. We went from small events up to events of 200 and 300 people being tested, and we needed volunteers to do that. We needed the volunteers to be able to make that work. And my expectation was that we would have wonderful volunteers that came in and were ready to work and ready to get the job done. And that's exactly what we received. We received folks who were dedicated, just like Teresa and Dave. They were dedicated to coming in and being boots on the ground. Again, we wanted to make sure that everyone was safe. We wanted to make sure everyone understood their roles. And as we're mentioning, every single event we kind of changed and developed because each event got larger and larger, more people involved. We decided to do one of the first walk-up testing clinics in the state of Virginia, and just the manpower that was needed to do that. And the MRC team just came together. Alyssa and Kate were were just champions in making sure that we had the volunteers that we need and the right volunteers in the right positions, that we had our nurses in where we needed nurses, and we had our logistics folks where we needed logistics folks. And so at that point, when those numbers started going and as the positivity rate started changing and more people started coming in for testing, we knew immediately that we would need more and more volunteers. We could have 35 volunteers in one event very easily in the beginning because we knew that that was what we would need. And the wonderful thing is that we were able to then hire some of our volunteers to actually be some of that core, that core group that helped organize. So I had a lead in testing, I had a lead in registration, I had a lead in logistics, and was able to hire from this wonderful batch of MRC volunteers that I had a chance to work with over, at that time, probably over a few months maybe, but just to work with and see the dedication that was there. And so definitely my expectation was that I'd have some great people to come in and work with, also realizing that this is a scary time for everybody and that not everyone wants to swab. Not everyone wants to do this or whatever. But what I received and what I received from Kate, what I received from Alyssa, what I received from our MRC volunteers was 100% support, 100% dedication. People were there every single event. We were having events 2 and 3 and 4 times a week, and you would see folks back every single time. And definitely my expectations, what I received, there was many more folks, many more, what's the way, how I want to say it, but I felt like I was given so much more than what I thought I would give and what thought I would get, I would say. I was given so much more depth, so much more support than I even expected to even have. And just to have MRC volunteers that you could count on, just to have Kate and Alyssa there to be able to say, hey, these are the folks they're going to take care of this for you, you're going to get it done, and just to have that support. So they definitely exceeded my expectation, and I'm so thankful because I know that we would not been able to put up an event while we're testing 500 and some people if it was not for all of the MRC volunteers that were there and those who kept coming and kept coming. So they definitely exceeded my expectations. I'm so thankful.
Thanks, Tracy. This next one is for Kendra. So talk about when you were kind of first made aware of COVID within your local health district, and then also knowing that you worked in multiple districts throughout the pandemic. Did you see any differences in their responses between the different, districts that you worked in?
All right, trying to unmute myself. There we go. So yeah, I became aware of COVID. I want to say our state polycoms was stood up in December, if I remember that correctly, early or mid-December. I remember us all going down to our conference room, and all 35 health districts were on that call, and those were really, really long calls. So that's when I was first made aware of what was going on. Like I said, I was on the onset, I was the DIS disease intervention specialist. So I was already embedded in the EPI team, and they needed additional hands on deck. So I happily obliged and attended all of those meetings. And so case wise, I took my first case in March of 2020. And that one, it was an interesting case for sure. So that's 2 parts of that answer of how I first became aware of COVID in Blue Ridge. As far as the differences across health districts, essentially we all did the same thing, right? But the setup was different. So we all had our ICS structure, but the folks probably fit under different branches a little bit differently. I would say the number of staff that we had across different health districts was practically based on the number of cases. So at the time, because UVA was doing a lot of testing, it felt like in the Northwest we had the most cases. Students were coming back. So obviously, again, you have the university smack dead center of the health district. So there were a lot of cases there. But then when I was in RAD, the Rappahannock Area Health District, we're right there on that I-95 corridor, right? So you have everyone going in and out of Nova folks live in Stafford but work in Fairfax or Arlington, they're doing that whole commute. So because of that, we did see a lot of travel, which meant more cases coming back to the health district. So we had tons of case investigators and tons of contact tracers compared to what I saw back in Charlottesville. So I think that was the biggest difference, was like the size of the teams. And then moving to Containment 2.0, everyone decided to use the folks a little bit differently. So all the titles were the same, right? So you have your traditional case investigators, your contact tracers, and then we moved into those strike teams, right? So you have your mitigation specialists or your PHIs. So every health district at that point, we're using them a little bit differently. So for instance, one district might use a mitigation specialist as their team lead. So they basically became like little supervisors of their specific teams, and they were the SMEs, the subject matter expert for that particular team. Whereas other districts may have used a mitigation specialist as just, a more advanced case investigator or contact tracer. So that's essentially the difference that I saw across those two health districts. And then, of course, coming to Richmond Henrico, again, very similar in that the mitigation specialists, PHIs, they were all utilized a little bit differently than they were in the Northwest.
Thank you. Okay, so this next question is for Dave. What was your first response activity? I think you talked about it a little bit in the beginning. How did it go, and was it what you expected?
Before joining MRC, I had spent a number of years as a...
Your sound is completely out, Dave. I can't hear you at all.
How about now? Now? How about I just get loud? How about now?
Yeah, that's better.
Okay. Prior to joining MRC, I was a volunteer first responder for a number of years with the fire department as a emergency medical technician and firefighter. And I was wondering a little bit about how that would fit coming into MRC. I've come to realize throughout the pandemic, with resources, you actually find a mix in different districts with the role of the health department and the role of other first responders in the area. We also had the benefit of working across, I think, most aspects of the response, from initial testing. We did contact tracing when that first stood up, and before it converted to hiring a staff, and then shifting into vaccination throughout. And what I've come to appreciate from a skill set perspective from my background was, yes, being comfortable with hazardous conditions, yes, being comfortable with universal precautions, PPE, things like that. Those are helpful. But I came to appreciate that as a volunteer, one of the most important things that I could bring to the equation was being comfortable in dealing with people who were in vulnerable situations, people who were scared. And a lot, as a volunteer, we were often the first face people would see, the first voice they would hear. And just simply being a reassuring, comforting, hey, we are glad that you are here, and we will find a way to get you to whatever you need at whatever phase things were. In some ways, it was kind of nice. We could be the feel-good people as the volunteers, and if it was anything really tough, we'd go get a career staff member to deal with those things. And I know, Kate, you'd always see me coming and finding you to grab somebody with those. The one thing I would add, and I would go back to a theme that I think sort of heard through Dr. Bray and through Tracy, and this is specific, I'll say, to my experience with the Richmond, Henrico, now Greater Richmond Health District, was the time and energy that the volunteer coordinators that Kate and Alyssa put into coming to know their volunteers. And that's how, Tracy, you got the people that you needed in the right places. Because as volunteers often bring a lot of different skill sets from their background that might not show up on that first piece of paper, that first application. Going to the safety officer perspective, I had a background as a safety officer, and when there were short edges at Arthur Ashe, then Kate said, wait, Dave, didn't you used to do this in your professional life? You can fill in when needed. So both Kate and Tracy took the time to get to know their volunteers, and they'd know who to go to for different things to get you the right people that you needed. And I think that was really an amazing feat to watch that pull off, how you did that with that increasing number of volunteers and could still stay on top of that and find the right people at the right time.
Thank you. Okay, Teresa. So you were an experienced RN coming into the pandemic. Do you feel like you learned anything from the response?
Yes, I very much learned from the response. In a nutshell, I feel like I learned about the beauty of public health, because working in hospitals, it's all about corporate health care. They're concerned about patient care, they're concerned about safety, but they're very, very concerned about dollars. So I felt we all should feel very lucky that our government funded the public health department so that we could put out this massive response. But yes, I learned so many things that I hadn't experienced before. Everybody was so flexible, and they were keen to hear our input. After each event, we would get a survey monkey. What did we do right today? What did we not do right today? And they listened to it. And it was really fascinating to see how we went from a very grassroots movement with each step of it, and it would just very quickly evolve to a polished machine. Dave said we did contact tracing in May and June, and I felt like I was in living history, because you could sense people's fear, yet gratitude that the health department was reaching out to them. And then it sort of evolved to, some communities were hesitant because they had to work, and they were nervous about the quarantine requirements. And then in June, it started to unravel a little bit for a lot of people, because the reality of, oh my gosh, I've got to work and the daycare shut down. And so you heard more frustration from families at that point. So that was really cool to be a part of that. And then I was involved in vaccination clinics, monkeypox, the massive response in winter of 2021 at Arthur Ashe is, I'll be an old woman feeling so proud of that. So yeah, it was just very different from corporate healthcare. And I feel lucky that I was able to be a part of it.
Thank you so much. So we're going to go back to the chat now for some of the questions that we were not able to get to the first time. So one is and I'm not sure who this, maybe Dr. Bure or Tracy. What are most challenges faced when the vaccine applied to children?
Well, give it both of us. I think it's totally both of us. At the very least, it complicates things in that you can't, especially with the youngest children, babies in arms, you don't necessarily want to have them the way that Arthur Ashe was set up, these large kind of almost these almost like they were machines where you were churning through folks. When it comes to smaller kids, you don't necessarily want to have them in these, we were, you think about, you don't want to have them in these giant spaces. Do we have to think about spacing things out differently? Do we think about, we also need to make sure that mom, dad, parent, guardian, someone is involved, is aware, engaging the parents to make sure that they are bringing their kids in, because this was a new vaccine. And so I would say that one of the biggest challenges that we had was for parents who were very, understandably concerned for a new vaccine for their child, was engaging them in safety and making sure that they are reassuring them about what we knew at that point about the vaccine. And then as we learn more, continuing to reassure them about the safety of the vaccine and being transparent about that, to try to make sure that folks felt comfortable bringing their kids in, as much as it was about the logistics of small child vaccine versus adult vaccination. Tracy, what would you add?
I would add that, again, with those larger events, you had parents that were scared. You know, they were scared for their children, they were scared themselves. And so one of the great things that our volunteers did, and as Stan and Teresa were mentioning, was that they supported those individuals and recognized the fact that needed to be a little bit extra care given to the parents. You know, even though they were there to have their child vaccinated, just to understand that, you know, I understand that this is a rough situation. Is there anything else I can do for you? I mean, just being a support for the parents when they had made a decision to come and have their child vaccinated, which I'm sure was something they had to think about, and just having the support and folks there to try to support the parents. And then also the other great thing we did, kind of a side note, was making sure those parents were vaccinated too. You know, that gave us an opportunity to make sure those parents were vaccinated as well, but just to support the whole family.
Great. Thank you so much. So I'm not 100% sure that I understand this question from Dr. Jim. Stock medical supplies are not in Virginia anymore, but we depended on federal sites to help the states. Should health systems have bigger supplies, or should we have state compact reciprocal assistance agreements? Bray, I'm guessing. Oh,
Apologies. As we get later into the evening, my ability to avoid snacking diminishes. I think that's a complicated question that I'm not sure that I'm prepared to answer right now, because I don't know. It's hard to know. I hear what you're saying. It's hard to know what's going to be faster in need. And I don't know that I have a form. I think I'd have to think through it before I'd have a formed opinion, honestly, because it's a good question, and I don't think it's a clear-cut answer.
Yeah, I don't know. Yeah, agreed. Just from the standpoint of being the PPE master for the volunteers, you know, there were moments of I would wake up in the middle of the night like panicking because I didn't think we had enough N95. So I think something needs to be done about that. But what is that answer? You know, you hold things in supply and then they
also in dire need, right? Health systems were in dire need. And so if we relied on them, the need may still outpace the demand, even if they had more. Do we want to have more at the federal sites? But then there's the slowness there. If there's compact agreements, then you have issues where if there's need in both areas, what do you do? I think it's a complex, it's a good question and a not easy. I don't know my opinion yet. It's a good question that I
get back to us.
I don't have an opinion yet on.
All right. Oh, yes, sir.
Just a thought from a former life on the military side of our compact agreements among states, especially when it comes into Homeland Security and Defense and the National Guard and such. All of the points that you brought up, Dr. DeVray, are very much things that we wrestle with from a vulnerability nationally in a Homeland Security perspective. And I would venture to say that that conversation is one across health and defense, not even to mention FEMA and so on, is if it hasn't been expanded to that broader context, it might be very worthwhile.
Yeah, thank you.
And
So
then,
the next question, oh,
I was just going to add one quick point is that, you know, we have to be very appreciative of the folks in our finance and purchasing departments in those areas, because they went out and they found the PPE that we needed. And not only was their role our role to stock PPE for us, but it was also, we had community providers requesting PPE. We had doctors' offices, veterinarian offices, dermatologists, and we were providing PPE for them as well. So I believe it definitely was difficult, but I definitely would say that I'm so appreciative that we did have what we needed.
mm-hmm.
So
yeah, agreed. Yes, Talon was amazing. How did Virginia compare to other states in the utilization of volunteers? We were legitimately number one. Not exaggerating. We had the highest number of volunteers. We had the highest number of hours at one point. That may have changed, but I know at one point it was like us in Texas like this. And then it was us. So, we have been approached by NATO and the program office to report out on how we did such an amazing job. And Alyssa, you can definitely add to this. One of the things that was very much in our favor is that even prior to COVID, we had huge backing at the state level. So we are so many other states, they're very siloed and they're very like a unit is its own unit and they don't have an amazing state structure like we do. And yeah, I mean, we blew it out of the water, basically. Alyssa?
Yeah, just to piggyback on that, when I presented at a national conference about what we did with some other MRC leaders from across the nation about what we did in Virginia and in our area, and remember some of the other states, like, how is that possible? And I said, well, a lot of different reasons, but a big part is that we had support locally, we had support regionally, support statewide, and I think we're very fortunate for that. And then having that support led to getting our name out there and allowing everyone to join us as volunteers. So I think that was a big part of our success. And no matter where you go in Virginia, you can find a unit, and that's not the same across every state. So I think that was part of our big success. But yeah, we number one.
And I would just say you all are the best, the absolute best. And every single testing event, Kate or Alyssa, you came to the event. So if we're having events 3 and 4 times a week, you guys were there. You were there to support your MRC. You were there to support us. So yeah, you guys were awesome. Definitely. Thank you.
So I think to Kendra sort of address this. What difference did you notice between health departments and health districts, as well as access to support from additional community agencies and organizations? I will say it seemed like it was us supporting the community agencies and not so much them. But that was just from my perspective.
Okay, so yeah, I did talk about this a little bit earlier. So across the health districts, again, how the structure was set up, essentially we all did case investigation, right? But it might have been a little bit different, and that the teams were grouped a little bit differently. As far as the community agencies and organizations, I would say those relationships were different across districts. So some were more embedded in health districts than others. You may have had a particular organization that, already had meetings with us. So I can think about like the pregnancy outcome group in Charlottesville. They would host a meeting every 2 weeks, I think. And they would do lunch and learns and things like that. So when they started to think about how COVID could impact pregnant persons, that was a group that was already, hand in hand with the health department. Same thing with social services, because the social workers went out to, patients, or well, they wouldn't technically be patients, but because they went out to community members' homes frequently, and that would have to bring them to their appointments. They already knew how to contact us when they suspected that the person that they were case managing either came in contact with someone with COVID and needed testing, or them themselves were, contacts in because they spent, an hour in a car driving this person to and fro, or being in their home. Now they're a contact and they need it tested. So those relationships, some of them were already there, and then others we had to build up, right? So we frequently fax blast a lot of providers, right, throughout the year, depending on what specific communicable disease is showing its ugly head at the time. So we might not necessarily have those direct contact, and relationships with those providers, but they know that we're here because they have to report or they got a fax from us recently, right? But then because of the pandemic, it was like, okay, I actually have to call to Kendra. I have to call, this nurse or whomever, just to make sure that they understand, what cases that I've come across in this particular, provider's office. I will say it was easier because of some of those relationships. It was easier to transition to. I can't remember the exact title. I feel like some of the roles changed. Is it the resource, not necessarily resource officer, but resource manager that was created with central office? It was basically, I can't think of the title.
The one that we call them navigators. We call them navigators.
Yeah,
I
yeah.
don't know
So
I
with
can't remember what the
containment,
title was, but we call them navigators. Mhm.
yeah, with Containment 2.0 came the navigator position, right? But during Containment 1.0, it was like, let's delegate this task to a specific person. So maybe it was a case investigator who did have experience, or a MRC volunteer that had experience as a social worker. So it was easy to put them in that position. I want to say some of our health districts, because again, they were in tune with the community and the agencies, that was easily done. And I think that funneled up. That wasn't something that came down from central office. That's something that went up. It's like, hey, we have this need. We're seeing more folks. We need them to stay home. We need them to quarantine. We need them to isolate, but they can't do it because they don't have food, or they are not going to be able to pay their rent. Because of our strong relationship with social services, that's something that went up to central office. Like, hey, we really need to put someone in this position that created that type of role. So that's some of the differences that I saw across health districts, and how we supported those community agencies and organizations.
I would even add, although I can only speak for the two that I know, Richmond and Henrico, we were fortunate in that I would speak to what TK mentioned, in that sometimes we built these amazing relationships, or we strengthened a lot of amazing relationships, because we needed to reach out around containment, around industries, around businesses, around whatever outbreaks were happening in whatever, whether or not it was a factory, a tobacco plant, whatever it was. We have contacts now that at that point were motivated to talk. And like, we generated these relationships that we might not have had otherwise, because we needed each other in a way that we hadn't before. I would also say that the community agencies, I think for Richmond and Henrico in particular, our faith community and or trusted folks in the communities already were critical when it came to vaccination and outreach and information and sharing information. Our partnership with Sacred Heart, or in Southern Richmond with our Latina population, our partnership with Second Baptist, Faith and Facts with Dr. Rob Wynn with the Mexican Cancer Center. A lot of these folks were already known by their own communities. And they weren't all faith communities, obviously, but like they really, when folks didn't trust us first point, they found that their faith leaders were echoing the same points that we were saying, and it helped to reinforce what we were saying, and maybe instill some trust in what we were saying. And I think it really brought out some folks to either vaccination events, or help people to buy into what we were saying.
That's great. Thank you. Alyssa, this one's for you. It's about volunteers. I don't know. Was any wellness intervention provided for volunteer teams who were dedicated to overcome the workload and the ever-changing events and updates?
Kate, feel free to jump in, because my memory is not great these days. I know we've had a few like statewide trainings for wellness, self-care. We had one recently this past December. We had one in the fall of 2020, kind of in the height of testing. And I know, like, locally, I'm sure each unit coordinator tried to provide support and kind of those wellness things for our own volunteers, because it was hard on everybody. But other than that, I think that's kind of one of our points that we're taking from this, to see what more we can provide for our volunteers in the future. Because I don't think we think about self-care and wellness and our mental health until it's too late sometimes. So I think that's one of our big points from that we're taking and trying to learn from and grow MRC here in Virginia to better provide for our volunteers. I'm sorry, I don't have a better answer than that. Kate, did I miss anything?
No, that's great. Does each MRC unit have a PPE pod in each of their regions? So the way that we did it was, the health district as a whole received N95s and gowns and all of that. And Alyssa and I, it quickly became clear that the one person who was assigned to be the fit tester at Richmond City was not going to be enough. So Alyssa and I became fit test trainers. We utilized the supplies that the health district itself had, and I imagine that that's the same across the state. So it's not MRC unit specific; it's health district. It was health district specific. Trying to. What'd you say, Alyssa? Let's see.
I was reading Carol's comment that your candy bowl helped a lot.
Has anyone? Oh, I don't know. Has anyone found out how the cloth masks were utilized during the time of mask shortage and hospitals called for volunteers to make cloth masks for their use? My understanding is that hospitals did not allow their employees to use these masks. I don't know the answer to that.
I'm not sure. Oh, go ahead.
I recall that we would have some cloth masks brought in, made by volunteers, and they were usually decorative, and we would wear them like over N95s for the decorative appeal. I do remember that. It wasn't that we were using them from a PPE perspective, but sort of from a wellness type perspective.
Yeah. Yep. And then did the MRCs, whoop, it's moving too quickly for me. Did the MRCs do any fit testing of volunteers likely to be using N95s? Yes. So we did a big, like the day that Dave and Teresa were talking about, we would set up in the clinic and take like 2 exam rooms and just rotate. We'd have volunteers sign up in VVHS to come in. And Alyssa brought Chick-fil-A, and that was amazing. And then we also, because we were both fit testers, and we also trained MRC volunteers to be fit testers. So we would have fit test kits on site at testing events. So if folks signed up who had not been fit tested, we would have them come early and fit test them on site. I think that's something that we can, as a VDH employee, you're supposed to be fit tested every year, but that's not a requirement for MRC volunteers. So I think that's something, it never was before. And so I think that that's something that we need to look at moving forward to incorporate that into potentially figuring out how to do that without wasting a bunch of N95s. All right. Any other questions? And Alyssa has one more round of questions for folks, and then we think we're going to wrap it up. Are you muted, Alyssa?
I just unmuted myself. Sorry. All right. So last round of questions for our wonderful panelists here. This question is the same across the board for everybody. What is your most vivid memory from the response? And what is your proudest moment? So we'll start with Takindra.
All right, so my most vivid memory was the very first case that came into Charlottesville, mostly because we quickly had to coordinate with other health districts because the person or the family rather traveled through a number of health districts and then across state lines. So how we all came together very quickly to make sure we contact trace properly, to assure that, everyone was accounted for, and then also doing that across state lines. That was quite a hefty task. So that's my most vivid memory. There were a lot of contacts from that particular case. And then the proudest moment, it wasn't a particular moment, but just, the feeling of camaraderie and collaboration and innovation that came out of all of this. I've been in 3 health districts at this point, and it never, felt to surprise me the amount of collaboration and just camaraderie that everyone shared across districts, and not even across districts, but across the state, right? So if there was ever a need for something, you could always reach out to another health district, your closest health district within your region, and they, had a fix, right? So We weren't short of innovation at all. And I'm very proud of us for being able to come together that way and help each other out in a time of need.
Thank you. Tracy?
Sure. My most vivid memory actually has to do, of course, with testing, is remembering the long lines that we had. The lines of people, the lines of cars, in particular at the Diamond, when we did a testing event at the Diamond, and we had cars just wrapped around that parking lot. We had our testing tables going, and just to see how many cars and how many people wanted to get tested, and just how dedicated our MRC was to getting that done, and how everyone stayed longer to make sure we got every single person done. Every single person got tested. Everyone who wanted to get tested got tested. And so for me, the most vivid thing was just seeing the large amounts of people that we were able to test, and how the team just pulled together to get it done. And I think the thing that I'm most proud of is that at a certain point, our volunteers were able to run the events without me. You know, at a certain point, I was able to. We had installed volunteers in so many of the right places that they knew the entire format of how everything was done. They did my little opening presentation. They did all of this, and I was so proud to be able to say at one point, like I don't have to be here. You know, you guys have this. You all are doing it, and you know it. And I was just really proud of that, and just being able to step back, and now having a couple of our testing folks that are still working in that testing field here with us. And I'm just very proud to be able to say that, you know, I worked with these gentlemen, and they're still doing it. And you know, you train people so that they can do what you can do, so you can step back and allow me to get back to clinical services once that happens. So thanks.
Thank you, Tracy. Dr. Vray?
Gosh, most vivid memory. There's a lot. I think I'm remembering a lot of late night phone calls. But the thing that just came to mind most, just off the top of my head, I remember being on a conference call with the district deputy at the time, TK, your predecessor, Rebecca, and Danny Avula, the district director at the time. It was 11:30 at night, and we were talking about a high profile, this is earlier on, a high profile nursing home outbreak. And I remember Rebecca and I were talking, and we've been talking for a little while, and Danny had been really quiet. And we're like, oh, he's just kind of doing his own thing. And then all of a sudden, like 20 minutes, wait, hey, Hayes, are you guys still there? He had fallen asleep on the floor of his like dining, whatever, the living room or the family room he was apparently, or something like that. And had totally passed out on the phone with us. And we had just gone on, we were just talking about the situation, kind of like next steps, blah, 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 blah. And he had no idea. He totally passed out. Hey, what were we talking about? So I'm sure he loves that I'm telling that story, but it does speak to, I do think what it speaks to is that everyone from the staff to the MRC throughout, I think through especially, you know, not just at the beginning when everyone was panicked and everyone was afraid and we were getting, you know, past the time when we were getting free food and free lunches from everybody because they were all grateful for us, we were still there. MRC were still showing up. Our staff were still showing up. People, you know, when Omicron came around, when vaccines came around, I still saw people pulling out all of the stops to try to get as many people vaccinated, to get as many people tested, to deliver whatever it was that we were hearing that we needed to deliver or that we weren't delivering, that we should deliver. I feel like I have never seen so many people, not just at the district, I feel it most in our district and with our district and our district's MRC, but I know this happened across the state. I've never seen so many people band together for a common cause over such a long period and do such amazing things. And I would never have guessed that we would have been able to do just that much. It was, and I think that I can't claim all of that because obviously that's a lot more than me, but it's just an amazing thing to have been a part of and to watch people, to know that when people really dig into it, not, you know, past the, no more accolades. People are tired of hearing from us. People are tired of talking to us. We're still there. And I think it's just been an amazing ride to watch people really pull all the stops out and continue to do so over years at a time. So I think it's not one event, it's over this period of time that's just been absolutely breathtaking and amazing to watch.
Thank you, Dr. Beret. Dave.
I guess my most memorable event would be the first day at Arthur Ashe that we opened up vaccines to then the senior populations. You know, we'd just been doing healthcare providers and all those kinds of people. And I think it was 65 and over, if I'm remembering correctly. And it was another one of those, 1,500 or so vaccination days. And it was a party. I have never seen so many happy people. Didn't matter if they were in a wheelchair, on a walker, they were the happiest they had been in years because there was hope. It's enough to get you going just thinking about it. It was just a positive, it was kind of a turning point. And that population was just so thankful and so awesome. As far as what I was most proud of, I think really comes from customer feedback. And, like you'd be at Arthur Ashe with, literally we're doing 1,500 people. And somebody comes up because they're back for their second shot and they go, "Hey, I remember you. You helped me last time." And that type of feedback. And same thing in talking with people, feedback you get in contact tracing. So some of the detail you might not have heard, Dr. DeVray. I remember we would talk early on when we were new in the contact tracing world, those unique situations. What do you do when you get an out-of-state person who came into state, had a contact, and we sat there and wrestled. We said, well, as a courtesy, we're going to follow up. And I remember the first person I called in a state that will remain nameless, that was just so ecstatic that we called it, this is purely a courtesy, you're out of state, we just want you to know. And they were just so happy and shared how their state didn't seem to care about anything, but Virginia was calling them and they were so pleased. So that customer feedback was probably for me the most rewarding thing.
And last but certainly not least, Teresa.
I remember taking care of sick people. You always see the expressions on their faces and the looks in their eyes. And early on, it was eye-opening to see how very sick people were and how scared they were. So I remember those looks. I remember going into a highly infected nursing home and they had quarantined a lot of the patients and how sad they looked because they weren't in their normal room. And then the people that weren't infected had to stay in their room and everybody just seemed to be languishing. And it was heartbreaking to witness that early on sickness. And my proudest moment is working at Arthur Ashe, giving the vaccinations and the organization and the high volume of people that we treated. I just feel really lucky to have been a part of that.
Thank you all so much. I really appreciate all of your contributions to this conversation. It's been amazing. I'll just throw in my proudest moment, even though I'm not actually on the panel. So just volunteer month, April of 21, we set up boxes in all of our major vaccination locations and had little cards where the folks who were getting vaccinated could write letters to the volunteers, little notes. And I saved out some of my favorites. We took pictures and sent them to all the volunteers. And one person just wrote, "Thank you for saving us." And I just tears me up every time I think about it. So thank you guys so much. So our very last situation will just be if you have any one or two brief last thoughts. And we'll start with Teresa.
I just feel very honored to have been a part of it. I didn't have to work during the pandemic. I was retired. I didn't have children at home to teach through Zoom. So I'm just really lucky that I had the opportunity to volunteer and ride my bike. It kept me going. But yeah. I'm grateful.
Tracy, do you have any last thoughts?
Just that I'm so thankful for our MRC. I'm so thankful that, we were able to take care of so many different people for testing and vaccination, and it was all because of our MRC. I hadn't had the opportunity to really work with MRC prior to COVID, but then during COVID, worked very closely and just have developed um, uh, an admiration for MRC just because of all the hard work you all did. And thank you.
Dave, last thoughts?
My last thought actually is a note I'd made and forgot to mention on the question of wellness for volunteers. And
Oh, yeah.
just to point out, Kate and Alyssa and everybody, you on a regular basis, I don't know if you realized it, but you were a big part of wellness for all of us when we'd come together. And quite honestly, us getting out and being part of something during this pandemic, I can say for me and for us, and I suspect for a lot of folks, was a huge wellness issue. And you enabled us to feel like we were contributing. And all those times when we'd sit around and chit chat, grouse, whatever, that regular conversation and the candy bowl were great wellness things for all of us. So thank you.
You were always affirming to us when we would get in a circle in the morning and discuss what we would be doing for the day. You always consistently affirmed us for being there, and we're very grateful for us being there.
Yeah, well, we couldn't 100%. You hear this all the time. Could have done it without you. We absolutely could not have done any of it without any of the Virginia MRC volunteers. Kendra, do you have any last thoughts?
Sure. So prior to the pandemic, I would also echo Tracy's sentiments that my interactions with the MRC was very limited. I did go out to a number of tabling events. Those are my favorites events to do in the community. And our MRC would show up. And that was always great to spend a few hours with them at the table and talk to other community members. But what you all did during the pandemic was nothing short of amazing, and super appreciative of your dedication and time and just, steadfastness.
Thank you. And then again, last but certainly not least, Dr. Beret, do you have any last thoughts?
To follow all y'all, I don't know. I do think I would echo that above and beyond, I think it was an honor for me to have as my job to do this work. But how much more impressive is it for folks to take, not because they're paid to do it, but because they of their own will are going to come out and take the risks and go out into the community at a time when folks are terrified because they know it's the thing that they want to do and it's the right thing for them to do. And I will say that I'm incredibly grateful for that. And it's mind-boggling. We couldn't have done this. All of those vaccines, 1,500 people in a day. No way we could have done that without MRC. All of that testing, all of the vaccinating, that there was no way under the sun we could have gotten away with that without our MRC. And so we extend incredible gratitude to our MRC volunteers, to Boz and to Lissa, who I'm sure I'm a little bit biased. I'm sure props to all of the coordinators, but man, we got really lucky.
There are several coordinators in here tonight.
Yeah, I'm sure you're all amazing. I'm sure they're all amazing. I can just specifically speak to our coordinators that they were hands down some of the most amazing folks throughout the pandemic. They were throughout all of this at all of the events, sometimes in multiple places at the same time. And it's an honor to work with all of you. And I really would love to, I hope that you continue. I really hope that this continues over time and that we continue to see and be able to take advantage of this work that you're willing to help us with so that we can continue to do this work in the community. So thank you all.